All right, everybody. It's Monday at 4 p.m. Welcome to today's update. For the most part, we have good news today. Cases are significantly, if not rapidly, declining, though we do believe that the weather and a lot of things closing for a number of days last week and into the weekend did have an impact that may make the drop in cases look a little bit larger than it would otherwise be. But regardless, we are definitely now moving in the right direction. Saturday, 4,816 new cases, 33 deaths. They continue to be a lot of deaths in some younger age demographics. So Saturdays included a 41-year-old woman in Christian County, a 46-year-old man in Kenton County, 47-year-old man in Letcher County, and a 31-year-old male in Perry County. Sunday, 3,696 new cases, 31 new deaths. They included a 32-year-old woman in Fayette County. And on Monday, today, 3,835 new cases, 29 new deaths, including a 46-year-old man in Davis County and a 47-year-old woman in McCracken County. On the good news front, today's positivity, 23.51%. Still really high, but significantly down from when we had crossed 33%. So decreasing about 10 percentage points on the positivity side in the last 2 weeks. All right, let's put up what we really want to see today, which is the stair stepper chart. Again, a significant and drastic reduction in cases from last week and the week before. Remember, with the ice storm that thankfully did not hit us as hard as expected, there was a lot of testing that was closed, a lot of health departments that were closed. So it's likely that the number of cases last week, 46,639, would not have been as low as it is, but still significantly lower than the week before. And let me give just a little bit of caution on this. Yes, we are really excited about the trajectory of cases, but remember, this is the fifth highest week in our entire COVID experience. So while we are moving in the right direction, there is still a whole lot of virus out there. So we'd ask people to continue to be careful. The next couple of weeks, the next month, we may see really serious reductions, which would be wonderful, which might get us to a place that we would all be excited about. Positivity rate, moving the right way. This one not as impacted by the lessening of testing. It's just a measurement of the tests that we did have, PCR tests. This is all PCR that week compared to the positives compared to the total number of tests. So that shows a good decline, one we ought to be excited about, maybe not as drastic as the one directly on cases. What I think that will likely mean, though, every time we try a prediction in this pandemic, it proves difficult, is that we fully expect to see a further reduction in cases for the week we are in now, but it may not be as large of a fall off to last week as last week was to the week before. We're also starting to see a real downward trend in hospitalizations. We almost reached hospitalization levels in Delta. It does look like we are declining. It is not moving as quickly as the cases, which is to be expected. It typically lags by a certain period. Vast majority of these hospitalizations for people who are truly sick are unvaccinated Kentuckians. ICUs appear to be leveling out. The ICU numbers do not get as high in Omicron because it appears to be less deadly or significantly less deadly than Delta. However, Omicron, yes, is significantly less deadly than Delta, but when that many more people get it, we still see very high numbers of deaths, and we're still seeing deaths of fairly young, unvaccinated Kentuckians, amongst others. Ventilators, this never became a major issue based on Omicron hitting you a little bit differently, higher than Delta. So we do not have a concern on the ventilator side, and they do appear to be decreasing. So over the past 7 days, hospitalization has decreased 11%, and that's our 7-day rolling data. We do have some more beds available than we did about this time last week, 141 adult ICU beds available. I will say during Delta, that was around the number we were a lot of times. Now, these are staffed beds. So it can be in this that we could have a lot of our nurses, doctors that are out, and when they come back, that number could jump. Or if more get infected, that number could drop fairly quickly. 36 of 96 hospitals reporting critical staffing shortages, but the reality is more than that. It's just people can see there is a light at the end of this surge and are pushing through it. If we show the hospital capacity by region, it gives us a better idea of exactly how many people out there are in the hospital and how stretched the system capacity is. But again, things are moving in the right direction. We don't hear as many alarms as we did last time because it does appear to be a more temporary surge that is beginning to subside. Vaccinations, of concern, vaccinations are slowing down. This happens, right? Cases go way up. People notice a little bit more choose to get vaccinated or fully vaccinated or boosted. And when things start looking a little bit better, vaccination numbers go down. We need to continue to push here. So when we look, total number of Kentuckians with at least one shot of hope, 2,862,756. The big change on the top is Kentuckians 18 and older. These are people who can make their own healthcare decisions. Now 76%, more than 3/4. Again, I want to make sure I emphasize that while sometimes the things you read or see try to talk about this view or that view of vaccinations, when 3/4 of people that can make their own healthcare decision choose to get vaccinated, it is an overwhelming majority that are making the right decision. We want to see that number continue to go up, but in all of the debates or arguments, more than 76% of people in Kentucky that can make their own decisions have chosen to get vaccinated. They are just fine, as are billions of people around the world. This ought to be sufficient proof for everybody else to jump on board and get those shots of hope. 75 and up, sticking at 92. 65 to 74-year-olds. These are our all-stars, now up to 97%. This is a group that has watched. This is a group that's been hit pretty hard, but a group that has gotten vaccinated. So to our 65 to 74-year-olds, please talk to your kids, talk to your grandkids. You know it's safe. Almost your entire generation has now gotten this vaccine. We could use your help. Next jump is the 40 to 49-year-olds, now up to 72%. This is really good news, as we have seen Delta and Omicron hit this age group a lot harder than Alpha or the original strand, and continuing to see an increase there is helpful. 25 to 39-year-olds, now up to 63%. Now, this represents a significant increase over time, especially since early on in vaccinations. We were very worried about 25 to 39. We're getting up close to 2/3. But I hope that age group will continue to get vaccinated as we continue to lose 30-year-olds. Not as often as we lose 40-year-olds, but we see it. Next age groups, we all need to do better. The only jump is 5 to 11, where we have had added a percentage, now up to 21%. Certainly, the 5 to 24 is where we see the vast majority, or the majority, not the vast majority of new cases. That's where the incident rate is the highest. And the incident rate is the highest where people are the least vaccinated. We want to move on. We want to cut down on cases. We want to see our numbers go down. We want more normalcy, getting more vaccines into arms for 5 to 24-year-olds is the right place to start and would certainly move us towards that goal. Now, news on vaccines for 5 and under. As many may have seen on the news, Pfizer is requesting emergency use authorization of the 2-dose COVID vaccine for children ages 6 months to 5 years. The FDA's vaccine panel is scheduled to meet on February the 15th to discuss the submission. The FDA committee, if they move forward, the CDC will still have to weigh in for a final recommendation. And just like we showed everybody how the kids' vaccine for under 12 is different than the adult vaccine. It comes in different colored bottles, and it is a much lesser strength for kids under that age than for 12 and up. You know, the adults and older children. It's even the same here with a much smaller dose there for 6 months to 5 years. This is something many parents and caregivers have been waiting for, but until it's approved, the most important thing we can do is to encourage eligible folks to get their vaccines and their booster. And we must continue to mask up indoors. Gives a quick lead in to say, please get your booster. When we look at Omicron and how it hits people, those are vaccinated and boosted, may not have any symptoms at all or feel like they have a cold. Those that have been vaccinated but have put off their booster, even though they could get it, feel a little sicker. Maybe they feel like they have the flu and it keeps them down for a couple days. Omicron still hits unvaccinated folks like a truck in most situations, causing them to feel ill at the least or very seriously ill. So the more vaccinated you are, meaning first shot, second shot, and booster, the more protected you are right now. Also wanted to show a graphic that I think I got out of order on masking. So the CDC, based on so much misinformation out there on their most recent studies, has come out with this graphic, which puts together all the research that's out there. And what it says is masks are incredibly effective in preventing people from getting COVID in the first place. And I want to kind of compare apples and oranges here because people are excited about, say, the Merck pill. And right now, the Merck pill looks like it could reduce hospitalization by 30%. Well, wearing a cloth mask, just cloth, appears to reduce your odds of catching COVID, and this was during Delta, by 56%, meaning it's significantly more effective in preventing something than one of the therapeutics is in treating something. It is even on that cloth side. I mean, if all my kids could tolerate is a cloth mask, sending them to school in it, reducing their chances of getting COVID by half is a pretty big deal. Once you move up to the surgical mask, and there are lots of these are easier to get your hands on. It goes up to 2/3 less odds, 66%. And then the KN95 or the N95 providing an 83% reduction. And so what this says is that masks work. Wear them when you think that you should. Even a cloth mask gives you, twice the protection of not having it. And certainly as you upgrade your masks, significantly more protection. It's important with such a rapidly spreading virus. All right, a couple other pieces of good news. In addressing the pandemic, we've continually tried to find ways to help Kentuckians to get through it and keeping their homes, because we had to do healthy at home for a while at a time when there were no vaccines, not even a hint. In fact, there were no treatments when we did healthy at home. We didn't have one proven treatment to help people survive this. We didn't have enough PPE for our medical staff, much less our first responders. And at the time we did healthy at home, the mortality rate was enormous, the way it was killing people in New York and New Orleans and others. Remember, they'd set up a hospital tent, huge, in Central Park, and the federal government had sent the medical ship in. Being healthy at home during that time had been so important. And so back in 2020, we were able to use CARES Act dollars to launch the Healthy at Home Eviction Relief Fund. That program helped renters to stay in their homes and provided much needed relief. And as you know, American Rescue Plan Act dollars have come on top of that to help people pay up to 6 months of back rent, to pay rent moving forward, and to help on utilities for renters. To date, $107.3 million has been deployed by this state to help our renters with housing and utility costs. There is still $95.7 million available. We want to deploy that to help Kentuckians. But through that program, homeowners, as opposed to renters, have said, what about us? We are also struggling. Well, now there's an answer. Thanks to $85.4 million in federal American Rescue Plan Act funds, we have launched the Team Kentucky Homeowner Assistance Fund. So starting today, qualified homeowners can visit our website to apply for up to $35,000 in assistance to help with delinquent mortgage payments, property taxes, homeowners and or flood insurance, homeowners association fees, and utility costs. If approved, the funds will be paid as a grant directly to mortgage servicers, utility companies, county property tax administrators, insurance agencies, or homeowners associations. We're thankful for these federal funds that finally came through with the guidance we need. And we want to get these dollars out there to homeowners that previously did not qualify for the help at that time we had to renters. We want to make sure that we help as many of you out there as possible. So if you are behind on your mortgage because of COVID, behind on your property taxes, behind on homeowners or flood insurance, homeowners association fees, or utility costs, this is a great way to catch up. Go to the website and apply. All right, Super Bowl coming up on Sunday. Go Bengals. But when you are there rooting for your favorite team, which ought to be the Bengals, we want to make sure you do it safely because we are still in a pandemic. So here is our tips for safely enjoying watching the Bengals win the Super Bowl. Number one, if you're sick, stay home, right? I know lots of people want to go out. You have a runny nose, you have a cough, stay home. You want to make sure that you don't infect somebody at a party, and that's the number one thing you can do. Any symptom of any sickness, stay home. Number two, all of your attendees should be vaccinated and boosted. That's what makes it safest. They should at least be vaccinated, but if you want the safest attendance you can have, you want everybody in there vaccinated and boosted. You want everybody to be tested if they can. And it's hard to get at-home tests right now, but that day or as close as possible to it. And I think if everybody else is doing it, you'll find that people are more willing to do this than you might think. If everybody's not vaccinated, we have to recommend that you wear masks. We still have a huge amount of COVID out there spreading. This is a place where you'll eat, you drink, and you'll cheer for the Bengals. We want you to be safe. And finally, if you can, if you threw really big ones in the past, you might want to think about making it just a little bit smaller, or two families that normally would host together, host them separate to keep them just a little bit smaller. Enjoy the game. All right. And last week we had a few pieces of good news we were going to share on Thursday, but we had our ice storm and we're focused on that. The first is a good economic development announcement. Last week I joined local officials in Bowling Green to break ground on Tyson Foods' $355 million bacon production facility, which is going to create 450 jobs. This is the largest economic development project in the history of Bowling Green to date. So pretty exciting. It's 400,000 square foot operation, again, representing the single largest investment in a new facility in that city's history. It'll help Tyson meet the growing demand for the iconic Wright and Jimmy Dean brands. The groundbreaking comes at a time of amazing economic momentum for the Commonwealth, last year being our best year ever with $11.2 billion of new investment, a record 18,000 new jobs, and at the second highest wage we've recorded in our history. And we didn't let up in January. It's one of the best Januaries on record, $660 million in new investment, 1,400 new jobs, and that was part of why S&P Global Rankings has revised Kentucky's financial outlook to positive. It's the first time we've been ranked as positive by S&P Global Ratings since January of 2007. That is a big deal. 5 years. I'm sorry, much more than 5 years in the making. 15 years in the making. So pretty exciting news. Thank you to Tyson for believing in us. Today, we also learned that the federal bipartisan infrastructure law, through it, Kentucky is going to have more than $74 million available to help us reclaim abandoned mines through the Abandoned Mine Land Program. We have shown and continue to show great ingenuity and creativity in creating the jobs of the future, and this funding will help create jobs by reclaiming these abandoned mine lands, making them safe and making them usable. We appreciate these funds from the federal government. I got a call from the what I call the Deputy Secretary of the Interior today. I ended it with, feel free to call me with $74 million anytime that you want. Quick update on some tornado relief. We're making progress on the Commonwealth sheltering program. To date, we have provided, we've put 15 families into travel trailers, and 3 more are going to be placed this week. The program is now expanded beyond families with school-aged children who are sheltering outside their counties. Now it's families with children and or elderly parents in their care, and they're being contacted by the Kentucky Emergency Management Team. One thing we're finding is a lot of families have found shelter and don't ultimately need the travel trailer, though I still believe that we will fill all that we have. We've just got to go through our list of priorities to make sure we don't leave a family of young children out that need to be closer to school. Survivors are asked to be aware that if they receive a call from Frankfort, Kentucky, a 502 area code, they need to answer. We're having a lot of calls that aren't picked up. Survivors have the choice of placing the travel trailer on their property if available and safe, or on public property. As a reminder, to be eligible, families must first register with FEMA before disaster assistance deadline of February the 11th. So again, we continue to place families. We know we'll see more this week in at least Mayfield and probably in Hopkins, and we are hoping in a couple other communities. Finally, an update on the Team Western Kentucky Relief Fund, providing you a quick slide on the breakdown of what's been paid out thus far. Funeral expenses for every single individual we lost. The first thing we did was mourn together. Now, the first group of uninsured homeowners and uninsured renters have received payment above and beyond their FEMA award. This is either 20% additional on top of their FEMA award, though we did set a minimum of $500 for those that would have fallen below that. In total, a little over $2.5 million out. We just got a new group of data from new FEMA awards that have been made to uninsured renters and uninsured homeowners. All of these checks are out. Hopefully, most of them have been received. There is more to come to those families. Next, we'll be looking at insured renters, insured homeowners, and then we believe we'll be after that at a place that we may be able to help, especially with some nonprofits out there at rebuilding homes and helping to get them back up as quickly as possible. So with that, we'll turn it over to questions. We'll start with our in-person journalist and Karen Czar.
Governor, with hospitalizations going down, will the National Guard be pulled out somewhat? Are we anticipating the numbers could go back up since that follows case numbers? And then details on the $35K for homeowners. What kind of paperwork and proof do they need to have prepared to apply for this?
Well, certainly the process. Can we pull up the homeowners assistance fund? The process will be outlined in the application. You're going to have paperwork showing you're behind on your mortgage or what you owe. I mean, all of this is proof of what you owe. So property tax bills, if it's that, insurance bill, if it's the other piece, and then the federal funds have some other requirements. But we look forward to working through with people. And if it is not up in detail on the website, it'll get up in detail on the website. National Guard is going to continue to help in hospitals. They are still in a very difficult place. I expect we will be there at least through the end of February, and then we'll be watching on what we're seeing from there. Mark?
With the pandemic approaching the 3-year anniversary in Kentucky, is there going to be a shift to an endemic strategy?
Yeah, a lot of talk is out there on pandemic versus endemic strategy, and I think a lot of that has to do with places that still have some significant restrictions in effect. We don't. Everything in Kentucky is open, everything, and there aren't capacity restrictions, at least from the state, in place anywhere now. You see giant sporting events where the schools and or the facility get to decide masking requirements or not. Individual school systems are making their own decisions. Where we had to shift to is guidance. And even in an endemic model, we'd be giving the same guidance on how to protect yourself moving forward. So I know that's a big national debate, but we're open, and we have been open. You know, the one thing that I would caution some on, because we do want to turn the page so badly, is our deaths are still really high. They're still really high. And there are some who are tired, and I get where they're coming from, that say, well, right now it's almost entirely an unvaccinated Kentuckians that we're losing, and it's their option to protect themselves. You know, I get that, but there's still people's family members, and there's still a whole lot of them we're losing. And I don't want anybody to pass away from COVID. So we're going to still give the best advice we can to protect people. But I do think that conversation is more of one being had in states that still have restrictions in place. Tom Latek, Kentucky Today.
Good afternoon, Governor, and thank you very much, sir. With the relief fund that you announced today, are there any income requirements or limitations or ceilings?
That's a good question. Not that I'm aware of, but we'll get you that information so people don't go through that whole application process and then find out that they are not eligible. I mean, certainly I think that there's some requirements that you show that you haven't been able to pay, where income could potentially come into effect. We can't use the federal funds where someone is choosing not to pay their mortgage, as opposed to has gotten behind because of impact from the pandemic. April Rickard from WFPL.
Hi, Governor. Thank you. I'm sorry if I missed this, but how many people are hospitalized today with COVID, and what percentage of this is hospitalized with versus incidental cases? And second, how many National Guard members are still deployed helping the hospitals? Thank you.
We have over 400 National Guardsmen deployed helping hospitals on any given day. I think it's around 440 or close. We had to pull a couple out of hospitals in certain regions to help with the ice storm, but we are at or around that number. I'll get you an exact one. We have 2,124 Kentuckians in the hospital right now with COVID. We don't have an exact breakdown on those that go in with versus go in and find that they have it. And the reason is the hospitalization number, as opposed to the death number, now may have more to do with capacity, hospital capacity, right? When we reach hospital capacity, we see more death, whether it's COVID or not. And the more people that are in the hospital with COVID, you know, that shows us how much it's spreading in the community and how many staff we may or may not be losing. So I get the breakdown is about how many people are really sick with COVID versus there for another reason and have COVID. But where we're looking at that right now, whereas in Delta, we looked at hospitalizations because it predicted a higher level of death. Certainly there's a significant level of death with Omicron as opposed to Delta, but it's not the same correlation at all. When I see this, it worries me that we don't have enough room for people having strokes or heart attacks, and we're still losing a lot of people to COVID. Debbie Yetter, Courier-Journal.
Hi, Governor. You mentioned that the rate of vaccination is slowing a bit. I wondered if you had any kind of current estimates on the number of people a day or week that are getting vaccinated. And also, do you all have any kind of projection or goal for what you'd like to see in terms of vaccinations in Kentucky overall that might maybe tamp this down once and for all?
Well, I'd like to see everybody vaccinated. None of us know what number you have to hit. I mean, I remember being on I think I was on Face the Nation with Larry Hogan, and we were getting hit hard with Delta, and And Governor Hogan, he's proud. They have a better vaccination, had a better vaccination rate. I think we have a better booster rate of people that are vaccinated at the time, but saying it wasn't hitting there because of their vaccination level. Well, they got hit later, and they got hit really hard with Omicron. So I don't think any of us know that number yet, but we're definitely slowing. So the exact numbers will come out with the report. But over the course of Omicron, over the weekends, if you remember, we'd have 7,000, more than that, 17,000 sometimes vaccinations or boosters. I think we have about 5,000 over this weekend on any given day, right? Sometimes you have 3,000, maybe 2,200 new people getting vaccinated. We're seeing that number at about 1,000 or under. So hopefully it's not progressively slowing. What we saw before Omicron and really before Delta is it got down to about 1,000 and it stayed there each day. But there's no question with Omicron surging and Delta that those numbers were up. Again, we'll get you the numbers to compare, but it's certainly under half of what we were seeing probably on a daily basis during the surge. Chad Hedrick, WKYT.
Hi there, Governor. With cases dropping, also seeing the vaccination rates dropping, and you mentioned a little bit about fatigue there as well. Do you have concerns that maybe people could be letting their guards down a little bit sooner than you would like, and before we get cases really down to those manageable levels?
Well, my concern is people didn't put their guards up, but certainly I don't see people letting down just yet. But I have a concern that they will. This is good news, but we are still really high, and people should be concerned that if enough people don't get vaccinated, we may see another thing like Omicron again. We don't know that which one of these will create enough natural immunity for those that haven't gotten vaccinated for us to get where we want to get to a place where, not that we're treating it like endemic, but it is from a scientific standpoint. So, people were really tired during Omicron, and we saw, big crowds of folks not wearing masks. And listen, all we can do is at this point is suggest to people it's better for their health. But I would, again, I'm certainly going to continue wearing a mask in crowds and indoors until that number is a lot further down. My hope, remember, is if you look before Delta over here, that was a great time. I mean, we hadn't gotten to feel like that in a year plus when it came. And while Delta then came and hit us hard, if we can get down to that level, it was pretty safe. It was pretty safe, especially with the number of people that have been vaccinated. So it's certainly our hope. Now, remember, at Delta, we never made it back down. We never made it down to the pre-Delta levels. And so we'll be watching Omicron pretty closely because we certainly don't want a higher plateau than Delta. We want to see that come down to the levels between Alpha and Delta, but that remains to be seen. Melissa Patrick, Kentucky Health News. I ought to mention on one of her stories, also used the CDC masking chart. Dr. Stackett separately provided that to me, but I want to give credit where it's due.
Thank you, Governor. So I saw today that the New Jersey governor had set a date to drop mask mandates in schools. And while I recognize that, we can't talk about mandates with you, but what are your recommendations for schools around masking? And while I anticipate your answer, what will it take for you to not recommend masking in schools?
Well, the two factors we'll look at are number of cases / positivity rate, which are still at about the 5th highest week in the entire pandemic, and then vaccination rates, which are way too low for kids, school-age kids, really, 18 or 19 and under. And either one of those could be the major lever for not needing to recommend it anymore. If we have cases that go down, especially to the level where they were, say, between Alpha and Delta. I think that's something that we can really, really look at. Or separately, if our vaccination rates went way up, then we'd have a much safer environment. Certainly doing it right now would be like doing it in the surge, because there's still that amount of COVID. And we don't want to see, our educators, our staff, not able to come in and thus having school canceled. So what we're seeing right now is government isn't doing anything to stop in-person classes. We're trying to encourage the steps to take to get as many in-person classes as possible. What we're seeing is COVID itself closing facilities, and I think closing more that may not take as many precautions as those that have less. Oh, thank you. Total number of guard in hospitals, long-term care, and we have about 8 in food banks, or a little bit more, 441. Corinne Boyer, WEKU, with our last question.
Hi, Governor. What will the average wage be for the jobs you announced at the new Tyson plant? And then meat processing plants have high rates of injuries and fatalities. What will Tyson do, or will Tyson do anything differently at this new plant to ensure the safety of future workers? Thank you.
Let us get you the exact wage with benefits. I know I mentioned it at the announcement itself. I believe it's in the mid to high 20s, but I want to get you that number exactly. A good wage. Excited about the job, especially with some entry-level workers potentially being able to make those dollars. We believe it is a good addition to the Bowling Green portfolio too, of the type of jobs that are out there. And in that Transpark, they very much wanted something in the food industry. Certainly, we take workplace injuries very seriously. That's why I recreated the OSHA board. That's why we investigate every workplace fatality. And we certainly have a commitment from the state side to ensure safety. This plant is going to be brand new. It's going to be more automated than any other one, I believe, in the world. It's going to look and feel very different from a lot of what we see in our mind about meat processing facilities. I know that they expressed a deep commitment to safety, and we will hold them to it. But I think we ought to see, it doesn't mean we will, but we ought to see, as we get new machinery, certain types of automation, new practices go into place, better workplace safety, and we ought to expect that every year, and certainly with every new facility that's put in. But the advantages of getting a new facility are very positive on the safety side. We will send you that average hourly wage that is also in their application process that resulted in the incentives. Okay, overall, pretty exciting day. Still a lot of COVID out there, but moving in the right direction. Stick with it. If this falls as fast as it rose, we're going to be in a much better place. But make sure you take care of yourself. Get vaccinated, get boosted, wear a mask when you believe it's appropriate, and we'll get through this, and we'll get through it together. Thanks.